You wake up with a strange heaviness in your stomach, you eat a simple meal and feel uncomfortable, bloated, or nauseous. You experience burning, acidity, gas, cramps, constipation, diarrhea, or random stomach pain, and you keep telling yourself it's normal, it's stress, it's food, it's temporary. But what if these symptoms are not random at all? What if they are carefully timed warning messages from your body trying to protect you before serious damage occurs? Because the harsh medical truth is that most dangerous digestive diseases do not begin with extreme pain or emergencies. They begin quietly with small daily discomforts that people normalize for years until the disease progresses to a stage where treatment becomes difficult, expensive, or lifelong. Your stomach is not just a food processing organ. It is a central control point connected to your brain, immune system, hormones, liver, pancreas, metabolism, heart health, and even emotional balance. And when stomach function is disturbed, it often reflects deeper internal imbalance long before lab tests turn abnormal. Persistent bloating is not just air. It can signal delayed digestion, low stomach acid, imbalance of gut bacteria, food intolerances, hormonal shifts, or chronic inflammation, all of which interfere with nutrient absorption, quietly weakening your body, lowering immunity, and draining energy over time. Chronic acidity and heartburn are among the most ignored yet dangerous signs because repeated acid exposure damages the food pipe, causes chronic inflammation, leads to ulcers, strictures, breathing issues, dental erosion, and significantly increases the risk of esophageal cancer. And while antacids provide temporary relief, they often mask the problem rather than solve it, allowing silent damage to continue beneath the surface. Recurrent stomach pain should never be dismissed, especially pain that appears after meals, wakes you at night, or improves briefly after eating, because this pattern often points to gastritis or peptic ulcers caused by infections like Helicobacter pylori, excessive painkiller use, smoking, alcohol, or chronic stress. And untreated ulcers can bleed internally, perforate the stomach wall, or cause life-threatening complications without warning. Changes in bowel habits are one of the strongest warning signals your digestive system sends. Long-term constipation may indicate dehydration, poor fiber intake, thyroid dysfunction, nerve damage, or even early intestinal blockage, while chronic diarrhea may reflect infections, inflammatory bowel disease, malabsorption syndromes, or immune-related gut disorders that slowly strip your body of nutrients, leading to anemia, hair loss, weakness, and fatigue. Alternating constipation and diarrhea, often casually labeled as irritable bowel syndrome, should never be ignored without proper evaluation because chronic stress, gut-brain axis disruption, food sensitivities, or low-grade inflammation can worsen silently if the root cause is not addressed. Black stools, visible blood in stool, unexplained vomiting, persistent nausea, or sudden unintentional weight loss are critical danger signs that demand immediate medical attention, as they may indicate internal bleeding, advanced ulcers, liver disease, or gastrointestinal cancers, conditions that are far more treatable when detected early rather than late. Feeling full after just a few bites, known as early satiety, is another subtle but serious warning sign that may indicate delayed stomach emptying, nerve damage from diabetes, hormonal imbalance, or pressure from surrounding organs. And ignoring it can lead to malnutrition and significant weight loss. Your stomach is deeply affected by your emotional and mental health. Chronic anxiety, depression, unresolved trauma, and constant stress directly alter stomach acid production, gut movement, and bacterial balance, proving that digestive symptoms are not imaginary but physical manifestations of a disturbed gut-brain connection. Modern lifestyle choices silently worsen stomach health, irregular meal timing, overeating, late-night eating, lack of sleep, and diets rich in sugar, refined carbohydrates, fried foods, ultra-processed items, fizzy drinks, and alcohol constantly irritate the stomach lining, promote inflammation, weaken digestive enzymes, and disrupt gut bacteria, creating an environment where chronic disease thrives. Overuse of common medications is another hidden threat. Frequent use of painkillers like NSAIDs slowly erodes the stomach's protective lining, dramatically increasing the risk of gastritis, ulcers, and internal bleeding. While unnecessary antibiotics destroy healthy gut bacteria, often triggering long-term digestive problems that persist long after the original infection is gone. Stomach and intestinal infections are far more common than people realize, especially in areas with poor food hygiene, and untreated infections can cause chronic inflammation, vitamin deficiencies, anemia, and persistent digestive symptoms that seem mysterious until properly diagnosed. Food intolerances such as lactose intolerance or gluten sensitivity quietly damage quality of life. People consume trigger foods daily, suffering bloating, cramps, diarrhea, fatigue, headaches, skin problems, and brain fog for years without connecting their symptoms to their diet. Liver, gallbladder, and pancreatic diseases often begin with vague stomach discomfort, bloating, nausea, or pain after fatty meals, and by the time severe pain, jaundice, or vomiting appears, significant organ damage may already be present. The greatest danger of stomach problems is normalization, learning to live with discomfort, relying on antacids, laxatives, herbal teas, or temporary remedies, instead of asking why the symptoms exist in the first place, because masking symptoms delays diagnosis and allows disease to progress silently. True digestive health comes from listening early, recognizing patterns, seeking proper medical evaluation when symptoms persist, and supporting the gut with balanced nutrition, adequate hydration, stress management, regular meals, sufficient sleep, mindful eating, and respect for the body's warning signals. Your stomach is not overreacting, it is not weak, and it is not trying to inconvenience you. It is warning you early, long before irreversible damage occurs, and paying attention now can save you from years of pain, medication dependence, or serious illness later. If you've been ignoring ongoing stomach problems, now is the time to stop normalizing discomfort and start listening to your body, because early action can be the difference between simple treatment and lifelong complications. If this video helped you understand how your stomach problems are warning signs you should never ignore, make sure to subscribe to the channel, turn on notifications, and stay connected for more clear, honest, doctor-style medical explanations that can genuinely protect your health, your energy, and your future.